We are live. We are live. I'm Dr. Frita, and it is Medical Monday, special holiday edition. Boy, do we have some hot health topics in the headlines to get to today. We'll start off with my favorite game, myth versus fact, because Mariah Carey has had to cancel performances. Why? Because she has the flu. And so we'll go over some myths versus facts when it comes to the flu. And we'll also do another myth versus fact on obstructive sleep apnea. Raise your hand if you snore. You know if you snore, if you call hogs at night, and if you've been asked to start a CPAP. Well, guess what? There may possibly be a treatment, a medical treatment for obstructive sleep apnea for all my snorers in the house. And then let's talk about Karen Huger. Y'all, I love Karen Huger. She's a star of the Real Housewives of Potomac, and she has now been convicted with DUIs. And we'll talk about alcohol, and we'll talk about what happens to your body when you drink excessive amounts of alcohol, and especially with the holiday season. We know that according to studies, people tend to drink twice as much alcohol over the holidays. So we'll talk about the science behind it and how to stay safe. And then we'll talk about the bird flu. Oh my gosh, the flu was all over the news. The bird flu is now a public health emergency in California. In the United States, we have our first severely ill human from the bird flu. We'll talk about it. I'll tell you how to protect yourself. And then let's talk about Halle Berry. Halle Berry. Y'all, Halle Berry is back in the headlines because she says that she is going to age gracefully, and she's sick of y'all telling her she's pretty. Okay. She says she wants to be known for more than that. We'll talk about aging gracefully and some things you can do. And can everybody age gracefully? I don't know. I guess I'll find out. And then if we have time, we'll get into Kim Kardashian. She broke her foot and she has a high heel fashionable cast. Is that just ridiculous and silly, or is that proper for health and on brand? I don't know. We'll find out. And then for my people who are members, we'll get a few questions at the end for the live Q&A. So get your questions together, and I'll see you on the other line, on the other side of this intro. I'm Dr. Frita, and this is Medical Monday. We are live. I'm Dr. Frita. Welcome to Medical Monday. Thank you for everyone who's joined in for this conversation where I'm about to give you evidence-based medicine on the hot health topics in the headlines. I'm not doing it alone. Y'all know I have my co-host and my practice manager to help me. Shador, come on to the front of the stage. Where you at, Shador?
Hey, Dr. Frita.
Hey, how are you doing?
I'm pretty good. About yourself?
I'm doing well, Shador. Thank you for joining me. Christmas is upon us. Are you ready? Are you ready? Are you ready?
Yeah, I think so. As I'm going to be. How about yourself?
I am, thanks to Santa's helper, specifically my freshman college student who came home and helped me finish. By help me, I mean did the rest of my Christmas shopping. So now I'm ready. I'm ready. And I'm also ready to get into these topics because let me tell you, Shador, in my house, my youngest daughter, Avery, as soon as, before Halloween even comes, she starts playing Mariah Carey Christmas songs. Okay. All I Want for Christmas, so forth and so on. But Mariah Carey has had to cancel several of her concert appearances because of the flu. You know, I know we talk about the flu vaccine every year, and some people get tired of people talking about the flu. They think it's no big deal. So let's do this. I want you to please roll the clip of Mariah Carey, and then we'll play my favorite little game, myth versus fact, when it comes to the flu.
Guys, Santa Claus might be coming to town, but tonight, Mariah Carey isn't. The singer announcing she had to cancel tonight because of the flu. Now, it was one of her last 5 holiday tours, and it was going to be here tonight at PPG Paints Arena. If you take a look here at the doors, that sign now posted. Now, that concert was supposed to happen tonight at 7:30. Fans finding out only at about 3:30. Now, we did get to speak to one fan who was here already. He didn't want to go on camera, but told us he's very disappointed to find out. Again, Mariah Carey tonight canceled, and I have to say, I myself am very, very sad about it. Reporting from PPG Paints Arena, Yasmin Rodriguez.
That's a mess. Now, don't you know people have been saving up their money, their time, their vacation hours, but you know what? Sickness waits for no one, not even celebrities. So I pray that she gets better from the flu. Meanwhile, let's use this to educate ourselves, and let's talk about the flu with myth versus fact. But first, Shador, who was the first person in the chat today?
Yes, absolutely. Our first person today was Andrea. Says good afternoon, blessed holiday season.
Yay, same to you, Andrea. Thank you for joining us. And y'all, please make sure you go ahead and hit that like and share. It lets YouTube know we're here, that we're giving evidence-based information, and I guarantee you will learn something to add to you having a healthier, happier life. So let's talk about how we can, hopefully Mariah can have a healthier, happier life, and all of us with the flu. Myth versus fact. Okay, I'm going to give you a statement, folks in the chat and folks in the replay crew. If you think the statement is a myth, put M1. If you think it's a fact, put F1, okay? And I'll give you the answer key in the end. Okay, number one, myth versus fact. The flu is just a severe cold, okay? The flu is just the same as a severe cold. Put an M1 if you think it's a myth, it's not true. Put an F1 if that's a fact, if it sounds right to you. Okay, the flu is just the same as old severe cold. All right. And for statement number two, myth versus fact. Put an M2 if you think this is a myth and an F2 if you think this is a fact. You can get the flu from the flu vaccine. You can get the flu from the flu vaccine, from the injection. Put an M1 if you think, nah, that's not true. You can't get the flu from the shot. Put an M2 if you think it's a myth, and put an F2 if you think it's a fact. And you know good and well people can get the flu from the flu shot, the flu vaccine. All right, pencils down, pencils down. All right, Shador, do we have any takers? Who likes to play my little game? Y'all know I love this game. Let's go to that first question, that the flu is really just the same thing as a severe cold. Anyone give me an M1 for a myth?
Yes, so Roxanne.
Okay, so she said it's not the same. All right, Roxanne. All right, who else?
JWD gives us a myth.
JWD, myth. And I'm wondering if y'all have actually ever had the flu, because a lot of us get the common cold in and out. You get the sniffles. And folks who've had the flu can probably answer this question pretty accurately just based on experience. Who else we got, Shador?
Members only, Miss Kim says a myth.
Hey, to my member, Kim, thank you so much for being a part of the community. Listen, for anyone who wants to join Kim and me and all the other members, just click the link in the description. My members only get a live Q&A where it's just us, okay, just the members only, where we go back and forth, and I'm live, I'm answering questions, we're having conversation. Also post videos that only the members see. The members will be the only ones who ever see these videos, where I give more health information and sometimes a few little extra twists and bends. So I do members only videos. And for videos that I release to the general public on this channel, my members will get a sneak peek. Plus, we have custom emojis, all kinds of fun things. So even if you don't join the membership, of course, I'll always give you the evidence-based medicine that I love to give. But if you want a little extra sauce, a little extra seasoning, some VIP perks, click the link in the description. Join us for the members only. And what we are going to start doing is for the live Q&As, it's going to eventually be just the members, just members only. All right. Thank you, Kim. Anyone else? Anyone say it's a fact that the flu is the same as the common cold, a severe common cold? Who thinks it's a fact?
C, Ross.
C thinks it's the same thing. Well, you know we don't have any vaccines for just the common cold. So that means you might think, why do we need a flu vaccine? It's the same thing at the same time. Okay, anyone else think it's a fact?
Rosalie. Hi, Rosalie.
Hi, Rosalie. So you think it's a fact. It's just the same old, same old. Anyone else?
OG Nadine.
OG says she ain't worried about it. It's the same thing. All right. So the answer to the question or to the statement, the flu is just the same as a severe cold, it's a myth. It's a myth. So everyone who put M1, you are correct. They're actually quite different. Yes, they are viruses, but the flu is caused by the influenza virus. And they're different types, type A, type B, type C. And some are just for humans. Some can go from humans to animals, animals to humans, and make a big mess, which we'll get into later, talking about that type of a flu. But the thing about the flu is that it tends to be more severe. Common colds or upper respiratory tract infections, rhinoviruses, tend to give you mild symptoms, a few sniffles, maybe a cough. You might get a little bit of a fever, but they're usually very self-limited and you don't get very sick. With the flu, it can really take you down. And so there are different types of flu, and we named them based on some of the outer coatings. So I'm sure you've heard of the H and the N, like H1N1. In fact, that Spanish flu, that famous pandemic of Spanish flu, was from an H1N1 influenza virus. And again, for certain types of the flu, they can go from animals to humans and back and forth. Here's the issue with the flu. If you're a person who's vulnerable, someone who's very young, someone who's elderly, someone who has immunocompromised, someone with HIV, a pregnant woman, someone who's a transplant patient, any of these people, if you're vulnerable or immunocompromised, you might not be able to get over the flu very quickly, and it could even have the consequence of taking your life. That's the seriousness of the flu. Flu can also cause issues like pneumonia. It can cause issues like sepsis or an overwhelming infection. And so it is recommended, and I know y'all have been around and you've seen different, major illnesses with the flu that has taken away young people's lives. So it is recommended that the flu vaccine be given every year to anyone 6 months of age or older. And the reason that we recommend the flu vaccine every year is because the flu mutates every year. The influenza virus mutates every year. And if you're wondering whether or not the flu is really no big deal, and if it's just the same as a cold, then just look at Mariah Carey. You know her voice and her performance. That is her backbone, her music, her love. There's no way she would be sitting up here canceling concerts unless that flu took her down. The influenza is more severe than the common cold. It's serious. Consult with your physician and find out the recommendations for you as far as getting the influenza vaccine. All right. Now for our next myth versus fact, you can get the flu from the flu vaccine. I can't wait for these answers. Who put an M2 if they think, nah, that's not true? You can't get the flu from the flu shot. And who put an F2 if they say, yep, you can do it. I've gotten it. I get the flu every time I get the flu vaccine. I want to see who says what.
Absolutely. So Riri, hi Riri.
Hi Riri. She what does Riri say?
Myth.
She doesn't think you can get the flu from the flu vaccine. Okay.
And Roxanne also says myth.
She says you cannot get it from the flu shot, the flu vaccine. Okay. All right. Does anyone believe you can get the flu, actually get sick from getting the vaccine, the flu shot, injection specifically?
Yes. Thurgood. Hello.
Thurgood. Okay. So Thurgood, you think, yeah, you can get the flu from the flu vaccine. Okay. Well, if you believe that, then you probably won't be a big fan of getting the flu shot. Okay. Who else?
Also Cindy.
Cindy thinks, yep, you can do it. Okay. Okay. So she thinks you can get the flu from the flu vaccine.
And Sheila.
Sheila thinks you can do it. All right. Myth versus fact. You can get the flu from the flu injection, the flu shot. That's a myth. You cannot get the flu from the flu shot. And I know those of you who said fact, you're like, I don't care what you say, Dr. Frita. I've had the flu shot and I felt sick and I know I got the flu from it. You didn't get the flu from the flu shot. Let me explain why. When you are giving the flu vaccine, you're actually given inactivated flu virus, dead virus. And so you cannot get the flu or influenza from the flu vaccine. But this is the nuance. Here's what can happen. You're still injecting something into your body that your body's immune system reacts to. And so you may react by getting a slight fever. You may react by feeling kind of some myalgias or muscle weakness. You may react by being tired. Okay. So your body may feel a little sick after you've gotten the vaccine. And some people feel very sick after the flu vaccine, but that's your body reacting to something that's injected to you, but it's not the flu because you're injected with a dead virus, and a dead virus cannot give you the flu. Okay. Can you get flu-like symptoms? Perhaps, but trust me, it's very different. Even if you do end up getting a little bit of the sniffles and you get a little bit, where you don't feel great after getting the flu vaccine, you have not gotten the flu from the flu vaccine. And whatever symptoms you have gotten from the flu vaccine, trust me, it's much better than if you actually get the flu and you end up having to cancel concerts like Mariah Carey, not being able to go to work, not be able to enjoy your holidays. And so as far as the flu injection, the flu shot, that's a dead virus. You cannot get the flu, but if you felt sick, I'm not discounting you. You may have felt a little sick because your body is reacting to a foreign substance, but it's not the flu. You cannot get the flu from the flu vaccine. Ooh, that's fun. That's fun. Okay, I had fun. Anybody else have fun? All right. Listen, y'all go ahead and hit that like button because I got another myth versus fact. Just one more little piece of the game, Shador. One more little piece of the game. And this, we're going to switch gears a little bit. Put a 1 in the chat if you know someone with obstructive sleep apnea. It could be you, it could be your spouse, it could be your cousin. And how do you know? Even if you don't know their official diagnosis, if it's someone who snores, I'm talking about calling hogs, it's loud, they're snoring, and then there's silence, they stop breathing. Sometimes you might want to shake them and be like, are you there? Are you alive? That's probably obstructive sleep apnea. Okay. It's a big deal, not just because it keeps everybody awake, child, and keeps you from having restful sleep. For the person who actually has obstructive sleep apnea, yes, it can cause daytime somnolence, meaning it makes them very sleepy in the day. It can also increase their risk for high blood pressure, for pulmonary hypertension, for heart disease. Okay. So obstructive sleep apnea is not a laughing matter. It's not just about kind of being the person who falls asleep in church and everybody can look and see your business that you're snoring. It's a health issue. Okay. So anyone put a 1 if they know of someone with obstructive sleep apnea, or at least they think they do.
Yes, absolutely. So Amelda, place a 1, and KK says myself.
Hi, KK. Okay, now KK, now we're going to talk about it. So make sure you consult with your doctor, because if you have that, you want to find out what they recommend. Like, do they recommend a CPAP, continuous positive air pressure? Like, you put it over your nose or over your mouth and it pushes air to keep you from having that blockage. That's a lifesaver. Okay. Anyone else who knows of someone with sleep apnea?
B.
Hi, B. Yeah, most of us know someone, or at least we've diagnosed them by sitting by them and they done fell asleep, hollering and snoring.
And R. Barnes.
Hi. So it's pretty common. It's pretty common obstructive sleep apnea. But yeah, I just want to make sure everyone understands. But here is the myth versus fact question I like to ask. Put an M3 if this is a myth, if you think it's a myth, and put an F3 if you think it's a fact. There is now a medication that has been FDA approved to treat obstructive sleep apnea. There is now a medication that has been FDA approved to treat obstructive sleep apnea. Put an M3 if, yeah, right, there's no medicine to cure it. That sounds crazy, right? Put an F3 if you know it's a fact. Do, 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 do. All right, pencils down. Any takers?
Yes.
All right. Who says the myth? There's no medicine to treat any doggone sleep apnea. You got to get the CPAP or just snore it out. Who says it's a myth?
Nora says myth.
Myth. There's no medicine, no FDA approved medicine to treat obstructive sleep apnea. Who else says the myth?
Sherman also says it's a myth.
Hi, Sherman. You think it's a myth? You think it's a myth? I'm telling y'all, I'm like Rumpelstiltskin. I love this little game. Okay, who else? Thank y'all for participating. It gives me joy.
Kelvin says the myth.
Says the myth. Does anyone think it's a fact? Now, this is going to be interesting. Who thinks it's a fact that there's a medicine? I'm not talking about CPAP. I'm not talking about that machine that can nobody stand. Oh, people don't like it. Who thinks it's a fact that there's actually a medication that's FDA approved to treat sleep apnea?
Jay Davis.
Jay Davis. What you know, Jay Davis? Okay, you think it's a fact. Who else?
Now this Miss Cindy, she actually, Dr. Fisher may know where you're going with this.
Where am I going, Miss Cindy?
She said it's a fact. Just heard it this morning. Zepbound.
Miss Cindy. See, that's why I love my med heads. Y'all stay on it. All right, Miss Cindy, you got it. You got it. It is a fact. But for everyone who says it's a myth, had I put this up on Thursday, December 19th, you would have been correct because there was no FDA approved medicine. But just as of December 20th, 2024, hot off the press, as Miss Cindy knows, we now have a medication that's approved to treat obstructive sleep apnea, FDA approved, and that medicine is, Miss Cindy, Zepbound. Move to the front of the class. So yes, Zepbound, as in tirzepatide, as in the other form of Mounjaro. Yeah, y'all know we talk about it a lot. The GLP-1 and GIP agonist, the drug that was originally studied for diabetes, and then the Zepbound specifically was approved for weight loss, okay, for people who are living with obesity or living with being overweight and having, other comorbidities. Well, now there has been an approval for obstructive sleep apnea. Does that make sense? Or are people just pulling stuff out of the sky? Well, they're actually not just pulling it out of the sky. There were 2 double-blinded, placebo-controlled trials where for 52 weeks, they studied people with obstructive sleep apnea with all of those issues that I was talking about, the snoring, being awake, and you're actually having many times where your breathing stops and your oxygen goes down with obstructive sleep apnea. They had a group of people who were receiving Zepbound with obstructive sleep apnea and another group of people in the study who received placebo. And they found that after 52 weeks, and there were 469 patient studied, that there was a clinically significant amount of people who had improvement in obstructive sleep apnea, specifically who were on Zepbound compared to placebo. So the ones who were on Zepbound over 52 weeks got better with their obstructive sleep apnea. Those who were on the placebo, pretty much like water pill or maybe just the salt water shot, they did not have the same improvement. So there are many theories as to why, and I'm sure that y'all could probably speculate. We know that Zepbound is approved for weight loss, and it is a risk factor for having obstructive sleep apnea if you're living with obesity or if you're overweight, specifically if you have a thick neck, okay? If you got a thick neck. So I want y'all to go get your tape measures or just get a string, kind of measure around your neck, the circumference of your neck, and put it next to a ruler or a yardstick. If you are a man and the circumference, okay, the distance around your neck is 17 inches or higher, that puts you at higher risk for obstructive sleep apnea. If you are someone who's a woman, someone born female, and around your neck is 16 inches or longer, okay, the distance, then that puts you at an increased risk for obstructive sleep apnea. So having a thick neck and then just living with obesity or living with being overweight puts you at risk. And so if you're someone with sleep apnea, your doctors talk to you, your sleep medicine doctor, they said, hey, do CPAP. Definitely follow what your doctor says. But now I want you to go ahead and ring them up and say, this medicine has been FDA approved. Am I a candidate to be on Zepbound? Get the pros, get the cons, make your own informed decision. But it is a fact that now, as of December 20th, 2024, we have a medication that has been FDA approved to treat obstructive sleep apnea, Zepbound. Thank y'all for playing my little game. All right. So now, Shador, let's get into the weekly dose. Let's get into a weekly dose of medicine in the news that has made the headlines. I'll give you a spin of it that you can't get anywhere else. All right, Shador. Can we start with Karen Huger from Real Housewives of Potomac? Yes. All right. I want to start with Karen Huger. And I want y'all to put a 2 in the chat if you watch Real Housewives of Potomac. Put a 2 in the chat if you watch Real Housewives of Potomac. All right. Let's go ahead and play this clip because Karen Huger has been convicted of driving under the influence and driving while impaired.
Tonight, a guilty verdict in the DUI case against Real Housewives of Potomac member Karen Huger.
Yeah, and just in, right now, we are getting our first look at the police body camera video from the night of the crash there in March that led to her arrest. Take a look as officers try to question Huger on the scene.
Karen, how much are you drinking tonight?
Talk to my husband.
Okay, can I talk with?
Yeah.
I can't talk to your husband. He's not really involved in this incident.
Yeah.
He can help me translate or get you to cooperate.
He is.
Okay.
He is. You okay?
How much you drink tonight? How much?
Are you good?
I'm good. I'm just saying, you know, they're assuming that you had more than you should have, and I'm assuming that you had like a couple of beers or something.
Yes,
like that.
that's all I had.
But
Okay.
you know,
You had a couple of beers.
Sure. That's
my assumption.
Okay.
I don't know. Sure, I wasn't with her.
Okay. I know. That's why I'm trying to communicate with her.
Yeah.
What kind of beer did you drink?
Were you good? Sweetheart?
Yeah. I don't see your license here.
I think one of my
somebody got him.
Yeah,
somebody got it.
worker has.
Because the bed was right there.
Yeah.
All right.
So we needed to write an accident report.
Okay.
It's okay.
So-
So Ray, darling, what
Yes.
do you say?
I'm saying that you probably had a couple of beers.
Yes.
And you're coming back.
Yeah.
And you said that you got run off the road.
I
guess
did.
did you hit the tree here or something?
It looks like she hit the center median, came across the median,
I
and then
did.
hit this tree as well.
Okay.
Again, that's Potomac housewife Karen Huger with her husband there at that crash scene in March in Montgomery County. Again, Karen Huger found guilty by a jury late tonight on this DUI trial, 2-day trial. She was found guilty out of 5 out of the 6 charges. We have much more of this video and this developing story that we're going through right now. This was all evidence during the trial. Stay with Fox 5.
Listen, I had to get up and walk away. I really don't enjoy watching her in this state, but she's obviously, slurring her speech, and she was found to be driving while under the influence of alcohol. And this is actually Karen Huger's second DUI. Okay. We know that she's 60 years old. She might be 61 at this point. Did we have any twos? Is anyone familiar with Real Housewives of Potomac? Any twos?
So yeah, our member only Kim.
Kim.
Not Karen, the dame of Potomac. Oh
The
my.
grande dame. Yeah, she's the grande dame. She's married. She calls her husband the Black Bill Gates, very well-to-do family, very high in society in the Potomac, like near Washington, D.C. And, it's all there right there on cam. And she was actually convicted. And I want to talk about this. And of course, I'm definitely wishing Karen well. The fact that it's her second DUI, I hope that she really is doing some self-reflection. I hate it for her that she has to do it in front of everyone. But one thing that's important to know about drinking, about alcohol, according to the CDC, alcohol is the number one cause of preventable death in the United States. It's the number one cause of preventable death. And if you think about her and how she swerved off the road, all of that, she could have easily had an accident that took her life or took the life of someone else, right? And we know that there are other things that alcohol can do physically that can cause you to be unalived. And so it's a really big deal, especially now. We know we're coming up on Christmas. We've got Hanukkah, it's the Christmas holidays, all of these things going on. And studies show us that people tend to drink twice as much as they normally do, twice as much alcohol. And so I do want to take a little time to talk about some of the consequences of drinking alcohol. And I want y'all to please, in the chat, go ahead and put some of the impairments that you think that alcohol can cause, be it brain, body, cancer, whatever. If y'all could throw that in the chat, and I'll go ahead and kind of see what some of your answers are, and I'll piggyback off of those. Also, I'll spend some time briefly talking about alcohol, what happens when what they're looking for in a sobriety test. And then I'll also direct you to my YouTube video right here on this YouTube channel. And for those of you who are new to the channel, I am Dr. Frita. I'm an MD. I'm a medical doctor who has been board certified in nephrology. So that means I'm a board certified kidney doctor and high blood pressure doctor. I have also received board certifications in internal medicine, pediatrics, obesity medicine. And so I like to talk a lot about a lot. But for those of you who are new, you're wondering, what am I talking about? And what gives me the authority to sit up here and talk about medicine? Well, it's because, yes, I'm nosy, but also I'm very well studied and very much board certified. And so I just enjoy talking about a wide variety of medicine. As for my current practice, I practice in Atlanta. Okay, I'm a nephrologist in Atlanta, and I'm the medical director of a nonprofit dialysis unit. And I love to do a lot of media medicine. If right here on this YouTube channel, where I'm very thankful to say that we have over 815,000 subscribers. Oh, y'all help us march on to 1 million. But we have those subscribers. And so for any of you who've been following me, who've been subscribed to me, then you know that I do a lot of media work. In fact, one of my playlists here on this YouTube channel, you can put TV appearances and you'll see where I've been on different national news shows. In fact, on Christmas morning, I'm going to be on News Nation, the station that has Chris Cuomo, Dan Abrams, and so forth, Nicole Burley, Nick Smith. I'll be on there on this Christmas. But if you go to the playlist, you'll get a chance to see where I've been on HLN, Paternity Court, Sister Circle, 11 Alive News, Fox 5 Atlanta, Fox Soul, all of those things you'll get a chance to see. And then very importantly, you'll see that I have hundreds of videos where I'm giving you evidence-based medicine. So check me out and go ahead and give us a like, please, as you come on in here to the room. All right. So did anyone say any of the consequences or the dark side of drinking alcohol?
Yes. So we'll start with Caddy.
Hi, Caddy.
Liver damage.
Liver damage, absolutely. So alcohol can cause cirrhosis. It's actually the second leading cause of cirrhosis of the liver in the United States. So hepatitis C is the number one cause. It can also cause fatty liver. So for some people who've been diagnosed with NASH, it could be, even if you, so for NASH, it's non-alcoholic, but you can also get a fatty liver that's caused from drinking alcohol. You can get an alcohol-induced cirrhosis of the liver. It can even put you at risk, an increased risk for getting liver cancer. So that's a good one. Thank you. Anyone else?
Yep. B, you just mentioned it, cancer.
Cancer, yes. It can increase your risk for liver cancer, but not just that. Excessive alcohol use can increase your risk for throat cancer, esophageal cancer. You know that too, that connects the throat or the pharynx to your stomach, the esophagus. Okay, listen, we have someone, a celebrity who just passed away within the past couple of years of esophageal cancer. Any of my med heads know what female artist passed away with esophageal cancer? Someone I actually got a chance to meet, a very nice, wonderful woman who passed away in a famous singing family. All right. Some other cancer. So yes, throat cancer, esophageal cancer. We talked about it can increase your risk for liver cancer. Alcohol can also increase your risk for colon cancer and for rectal cancer, okay? And so it can literally cause a mutation in the DNA of your cells, alcohol can. All right. Anyone else? And let me know if anyone pops in with the celebrity who passed away with esophageal cancer. She's
Absolutely.
Okay.
All right. So Cindy. Oh, okay. VE and KK both chimed in with Tracy Braxton.
Yeah, y'all so smart. I love y'all. Yeah, Tracy Braxton. She passed away with esophageal cancer, and it was a shock to all of us. And Shador knows we got a chance to meet her because, as I mentioned, I'm a board certified kidney doctor, and we're very active in the National Kidney Foundation. I'm a board member here in Atlanta. And for one of our fundraisers, right, to help promote awareness of kidney disease, Tracy Braxton was our special guest. She sang, she talked, and very importantly, she was so kind to everyone, including I had some patients there. I always invite patients. I pick a few patients to be my special guests for these galas, these formal galas. And she made my patients feel like they were the absolute VIPs that they are. And not just her, Mama E, Miss Evelyn was extremely warm. And she can dance. Look, I was on the dance floor with Mama E. But yeah, Tracy Braxton did pass away with esophageal cancer. And yes, alcohol, I'm not saying this is her cause, but alcohol can increase your risk for esophageal cancer. Smoking cigarettes can increase your risk as well. And sometimes we don't know why. It's the luck of the draw. Some people will get esophageal cancer. And even if someone has heartburn, GERD, gastroesophageal reflux disease, if you're having that acid that refluxes from your stomach back into the esophagus, that can put you at risk for esophageal cancer as well. Yeah. All right. Some other things that alcohol can, did anyone else chime in with anything else? So I'll just quickly run the list and then we'll move to the next topic. On to the next.
Cindy has a short list, Dr. Frita.
Oh, give me the list, Cindy. You know what, Cindy? You at the head of the class now.
Fatty liver,
yes,
dementia, and heart
problems. Yes. Alcohol use can increase your risk for memory loss and dementia. Very important. And not only drinking excessive amounts of alcohol, but also even moderate or less than moderate alcohol has been shown in scientific studies. It can be associated with the shrinking of the brain. That's a good one. What else, Cindy? What you got?
She said heart problems.
Yes, drinking excessive amounts of alcohol can increase your risk for heart disease, and it can specifically cause something called dilated cardiomyopathy, where your heart gets really big, not in a good way, not in a giving way, but where you get stretched out muscles of the heart, and your heart can then be at increased risk for arrhythmia or abnormal heart rhythm, which can lead to a sudden being unalive. Okay, so alcohol can put you at risk for dilated cardiomyopathy, where you might even get to the point where you need a heart transplant. That's good, Miss Cindy. What else you got?
Did you already talk on fatty liver?
Yeah, I did briefly talk about the fatty liver. That's
all
good.
Right, so that's our list.
Okay, that's really good. So yeah, so we ran across some of the complications, and just for keeping with Karen Huger and some of the field sobriety tests they were doing, or even just in the conversation, the alcohol can definitely affect the way that your brain processes. Can cause you to have a slowed movement, slowed speech. It can cause you to, lose coordination, have an ataxic gait, meaning you might have a wide base gait. And it can also cause some personality changes, okay, where you might say things that you normally wouldn't have said, be bold when you normally wouldn't have been that bold. And we talked about, I think just last week, if you drink alcohol on an empty stomach, it can certainly increase the quickness of you becoming intoxicated and can potentially increase the toxic effects. For more information on alcohol, make sure you check out my video right here on this YouTube channel, The Dark Side of Alcohol. And remember, over alcohol, people tend to have more drinks. And just let me give you the CDC definition of what's considered a drink and what's considered drinking too much. For women, people born female, if you have 8 drinks a week or more, it's considered to be excessive alcohol use. For people born as men, if you're a man, drinking 15 or more drinks per week. Okay. They have a gender discrepancy. Don't ask me why. Also, binge drinking, which is for a woman, 4 drinks at one setting. For a man, 5 drinks at one setting, like within a couple of hours. And what's the definition of a drink? Because yes, it matters. If you tell me you just have 1 drink a night, but you're sitting up here with a 32-ounce tumbler of dark liquor, Hennessy, dark liquor get you there quicker. 16 ounces of alcohol, just because it's in 1 cup, that's not 1 drink. 1 drink is considered to be 5 ounces of wine, 12 ounces of beer, 1.5 ounces of like a stronger alcohol, like an 80 proof alcohol. Okay. That's considered 1 drink. If you have people who are heavy handed, it might be in 1 glass, but you might be sitting there drinking 2 or 3 drinks in 1 setting. So just be careful. Okay. Be honest with yourselves about your drinking and just recognize what's going on in the during the holidays. And listen, it's 2024. We've got Lyft, we've got Uber, we've got rideshare, we've got friends, and you have the ability to just stay in the house, okay? Or sleep over at someone's house. If you've had too much to drink, please don't put your life in danger. Don't put other people's lives in danger. Just be smart, be safe with the holiday. And I still love the Grand Dame, Karen Huger, and I pray that she does well in getting through this. All right. Let's move on to the next. Let's talk about Halle Berry. Halle Berry. Listen, I want y'all to put in the chat, what is your favorite Halle Berry movie? Put it in the chat. What is your favorite Halle Berry movie? You know that Halle Berry is a world-renowned, Academy Award-winning actress, okay? And she's very, very well known for her beauty. In fact, she's among some of these Hollywood actors who started really being on the covers of magazines, and some of the models, okay, the supermodels started getting annoyed because they're like, here we are, we're 5'10", we're 6 feet tall, we're size 2s. We're supposed to be on the cover of magazines, but beauties like Halle Berry started taking over the covers of magazines, and that was a thing, may still be a thing. At any rate, now we know that Halle Berry is getting growner, like all of us are. She's good and in her 50s, and she says that she's actually tired of her beauty being the center of conversation. She wants to be known for more than her beauty, and she wants to allow herself to age gracefully. So let's roll that clip, and then I'll see what your favorite Halle Berry movie is.
Something to me other than, oh gosh, you're so pretty. I've longed to hear other words. I know I'm more than this. So as I've aged, I've been determined to age gracefully and naturally. I think it's a shame that as women, we're being told that we find a way to stay eternally young forever, 30, as though we're not allowed to be human and do what we're naturally born to do. We're born to age and die. But somehow as women, we have to do the unthinkable. We have to figure out a way to do it. And unfortunately, we're turning ourselves into monsters trying to do that. So I'm committed to being a spokesperson for allowing yourself to age gracefully, knowing that you're more than this.
Okay, I hope y'all were able to hear that well. It's put a little fast on my end, but bottom line, she was saying that she wants to age gracefully, which I assume she means that she's not going to be doing all the Botox, all the fillers, all the facelifts. This is what she's saying. Now, y'all know I do allow people, I reserve the right for people, they can change their minds, but she says she wants to age gracefully, and she feels like it's an unfair standard for women, especially, to feel pressured that they have to look 30 from now until the end of days. She said, aging is what we're meant to do. We're meant to age and then be unalive. She put it pretty bluntly. And so I thought it was pretty remarkable for someone who's known for beauty. Beauty is her brand, to say, she's sick of it. She wants to age gracefully. And so I'm going to ask you, I'm going to see what you put for your favorite Halle Berry movies, but then I'm also going to ask you the question, what do you think about her statement, aging gracefully, and how she plans to age gracefully? Because here's the truth of the matter. The way that Halle Berry ages is going to be different from how everyone else ages. Okay, let's just be real. She is aging gracefully. She looks beautiful. She still looks younger than her age, but everyone's not going to age the same way. So is it fair or reasonable for someone who happens to have really good genetics and who is aging gracefully and who is beautiful to start with, for her to lead the campaign of aging gracefully? Or for those who don't age gracefully, who do get a lot of wrinkles, whose skin sags, is it just kind of like unfair? In other words, yeah, it's easy to say I'm going to age gracefully if you're aging gracefully. Is she being unrealistic, or is she really being helpful to the movement? I want you to comment. So yeah, tell me your favorite Halle Berry movement. And if you have any type of a comment on her aging gracefully, I want to know. Put 3 if you're like, yeah, I think this is a very good, realistic campaign. Put a 4 if it's just like, yeah, easy for her to say she happens to be beautiful and aging gracefully. I want to know what you think. All right, what are my med heads saying in there? Favorite movies, and who's putting
favorite movies? Kim says Losing Isaiah.
Ooh, she was good in that. That was when we got to see her serious side, not just the beauty side. That's good. Yeah.
Miss Nora, Dorothy Dandridge.
She's a dead-on match for Dorothy Dandridge too. I saw that one too. That's good. I forgot about that movie. She looked very similar to Dorothy Dandridge. Who else? That's good.
Cindy says Kidnap. That's a good one.
Oh, I didn't see that one. Do I need to see that one, Miss Cindy? Okay,
good.
that's gonna be a good holiday watch. Have you seen that one, Shador? Kidnap.
I have.
Go see it. Okay, hopefully it's on Netflix or Peacock or one of these streaming. I need to. there's some kind of an app, Rocket Finder, where you can see how many streaming apps you're paying for. I look up, my kids are always watching something on Hulu or Netflix. I'm just like, did I approve all these? Are all these in bundles? I need to check it out. Okay, well, if it's on one of these streaming apps that I have, I'm definitely going to watch Kidnapped. Anyone else?
Jay Davis says Monster Ball.
Now, you know, that's my least favorite, Monster Ball, but that is the one she won the Academy Award for. So I felt like she won the Academy Award. She was kind of in a stereotypical role that's not always positive, like the stereotypes of certain, how they see certain Black women. Just like when Denzel won the Academy Award for Training Day. Now, he deserved it, and she deserved it. I'm not saying that they didn't, but Monster Ball is not my favorite. That is her Academy Award winning role. And yeah, she was all the way out of character. So in other words, she really was showing her acting chops. So I can see why you say it, but you know, I be having my attitude. All right. Did anyone comment on the aging gracefully thing? Because and let me tell you, I'm going to go ahead and put my comments in on the aging gracefully. I'm all for her. I like how she's saying, hey, everybody, you know, I'm going to age gracefully. Let's stop having these unrealistic standards. But when I step out into my cynical side, I'm like, I still have to be careful, you know, as far as me and saying people should age gracefully. I don't want people to do ridiculous things, but sometimes for different procedures that people do to help themselves to feel better about their looks, I will sit here and I will roll my eyes and be judgmental, judgy-wudgy, but was a bear. But when I step outside of myself, I have to be like, you know what? Don't judge. Case in point, I'm tall, right? I'm 5'11". There are people who have procedures to lengthen their legs and make themselves taller. I roll my eyes and I'm like, why are you going to do that? You shouldn't do that. That's such an unnecessary procedure. But if I stop and I practice empathy and I put myself in someone else's shoes, especially a male who's shorter, and we have scientific data to show us that males who are shorter tend to get paid less, tend to get less leadership positions, socially have challenges. If I put myself in a male, you know, a man who's 5'5", then maybe if I were a man and if I were 5'5", maybe I would want to have a lengthening procedure to make myself taller if I could do it safely. In other words, it's easy to judge if you don't have the problem. Okay. And I'll take it another step. Okay. Some of the facial things that people get done to make themselves look better or look younger. One of them, people will get like cheekbone implants or cheekbone fillers. I did not know people did that until people, Shador, you know, a friend of mine, lovely lady, a lovely white woman, she actually put her hands in my face and touched my cheekbones. And she said, oh, those are real. Those are your cheekbones. I said, yeah. This was years ago, and I didn't know people were doing cheekbone implants or cheekbone fillers. And so in my mind then, I'm like, why would anybody do that? Why would you get, you know, that stuff in your face and make your face, da, da, da. But then I had to pause. I'm like, well, maybe I don't care about cheekbones because I got cheekbones. I had them all my life. You know what I mean? And so if I step out, you know, if someone can do something safely that they want to do, okay, go for it. Now, granted, you know, we just talked about Brandy Glanville. Y'all check out the replay for last week. We talked about Brandy Glanville. She's an alum for Real Housewives of Beverly Hills. She's someone who's had many, many facial fillers. Now her face literally looks deformed and she thinks that she might have a face parasite. People go overboard. But I say that to say for people who are careful, seeing board certified dermatologists, board certified plastic surgeons, or people who are actually certified and well educated in doing, you know, anti-aging procedures, I have to step back. Now, let's take it to Halle Berry. Halle Berry is gorgeous. She has all the things, all the facial features. Her skin is smooth. She's slim. And yes, she's healthy. She works. She eats in a healthy manner. And she's actually a diabetic. And she makes sure she's very careful with her blood sugar. She does work, but she also has a lot of genetics. Is it easy for someone like Halle Berry to sit back and say, hey, everybody, let's age gracefully when she already is aging gracefully? Yes, by hard work, but largely by genetics. Should she say that? Is she helping? Is she being encouraging? Or is she making people who don't look like her roll their eyes and be like, yeah, easy for you to say? Did anybody comment? Are they 3? They think she's doing a good work, or 4? They're rolling their eyes because it's easy for her to say because she doesn't need it. She doesn't need the anti-aging.
Yeah, a lot of 3s for me. Also 4. So KK says helpful. Lifestyle makes a big difference in everything.
True. Yeah, and that's why I did want to be careful to mention. I don't want to diminish the fact that she does work hard in her eating and her exercise and in her meditations and trying to be helpful. Okay, so you think it's helpful. Good.
And Cindy, she has great genes and has the means to live a healthy life.
She does. She does. But even for those of us who don't have the same means in our day-to-day choices, fried chicken versus grilled chicken, quinoa versus macaroni and cheese, we also have some choices. But yes, I would be disingenuous if I said that having high means where you can possibly get a personal chef, you can afford all of the whole food sprouts, the more expensive organic foods. Yes, that helps. Yes, that helps. And genetics help. Okay. Who else?
Kelvin says 4. She has
4.
Hollywood money.
You know what, Kelvin? Why you got to come up here and put a 4 up there? Okay, so you had that little bit of a skeptical piece that I had. Like, yeah, that's kind of you to say, but all these other women who just said I'm gonna age gracefully too, they're not gonna look like Halle Berry, are they? Yeah, she has Hollywood money. Yes, she still has to work, but it's different. We have to be honest. Having the money is different. All right, but yeah, yeah. All right. Anyone else chime in before we move on? We might have time for a couple more topics. Let's see. What do we have time for? Well, we might be able to hit something else. Let's see. We didn't talk about bird flu yet, did we?
No, we have not.
Okay. All right. Y'all, we talked about the regular flu. Let's chat about the bird flu because we know that, gosh, and we reported it right here on this channel where birds, cows, turkeys, chicken, there was lots of infection, lots of contamination with the bird flu, and tens of millions of birds like chickens and even the eggs had to be discarded of. Okay, so that really hit the poultry industry and the chicken industry hard, and many cows even had to be unalived because of being infected with the bird flu. Okay, and we saw some of these cases where people got pretty sick and even lost their lives in other countries. Well, now the chickens have come home to roost. No pun intended, because now the bird flu in California is a public health emergency, and we've had our first very serious infection requiring hospitalization due to a case of bird flu here in the United States. So let's roll that clip and talk about how to be safe from the bird flu.
We turn tonight to the growing concern over bird flu right here in the U.S. Tonight, California, in fact, declaring a state of emergency now because of the sheer number of cases there. And tonight, the CDC now revealing the first case of severe bird flu in a human here in the U.S. ABC Steve Osunsami at the CDC in Atlanta tonight.
California's state of emergency tonight will give public health officials more resources and people to fight the bird flu virus that spread from animals to humans and made dozens of farm workers sick. This year alone, tens of millions of
Okay, let's hold this one. It's going a little fast.
61 people.
Let's say we'll pause this. It's going a little fast, but I'll tell you that yes, 61 people in the United States have gotten sick with the bird flu. One has actually been hospitalized with the bird flu. And what's been revealed about the person who was sick enough to be hospitalized, we know that he's from Louisiana. He was older than the age of 65. He did have some underlying medical conditions, and he is believed to have gotten the bird flu from birds that were unalived in his backyard and some birds that were sick. Okay. Now, classically, we know that farmers have been the ones who've been getting sick. Okay. They've been getting sick from infected cows, turkeys, chickens. Okay. And so, as I mentioned, we've had lots of, the cattle industry, lots of issues by having to unalive the cows, unfortunately, due to the infection. But I do want to talk about the bird flu. So far, and this is very important, we have not seen any human to human transmission thus far. We have not seen any human to human transmission. The transmission has been from animal to human, but still you want to make sure that you're careful, pay attention to what's going on, especially if you're living in California right now, because there's a public health emergency. Find out from foods that have been recalled, foods that are believed to have been contaminated with the bird flu. If you work around cattle, if you work around turkeys, if you work around chickens, make sure that you're wearing the proper protective gear. Make sure that you're only if you're dealing on a surface that has had a cattle that could possibly be infected, make sure that you're washing it, that you're putting on all the protective gear to protect yourself. So stay tuned. Again, there have been 61 cases. Half of them have been in California as far as people in the United States with the bird flu, but it's here. So pay attention to the news. That's some of the medicine in the news that's made the headlines. Okay. All right. Do we have any comments thus far on that? That's that on that.
No, not directly to the bird flu.
Okay. All right. So we'll hit on a couple of more topics really, really quickly. And then for a couple of questions we do get a chance to answer, I'm going to go ahead and give priority to a member. So if you're already a member, if you have a question, then you will get prioritized. Or also, if you put in a super chat, then I'll make sure that we get to your question. But for those of you who really want to do some live Q&As where you have a nice extended period of time where we're going back and forth and you get your questions answered, then make sure you click the link in the description. You join our membership. And if you're someone who wants just a one-on-one conversation with me, as I mentioned, and for those of you who are new or just tuning in, I am an MD. I'm Dr. Frita. I've been board certified in nephrology, internal medicine, pediatrics, obesity medicine. And so I know a lot about a lot. And more importantly, I enjoy sharing the information, but I do have a telehealth concierge service. So if you click the link in the description, you can set up an appointment with me where we do a full history. Okay. And I can give you my advice or my information based on your history. I can give you a second opinion and I can talk to you from anywhere in the world. Okay. We've had patients. I've gotten a chance to meet people from all over the world, literally through this telehealth concierge service. So again, if you want to take advantage of this one-on-one conversation with me, I've really been enjoying it and been able to really, really help people, which is my joy. But yeah, click the link in the description and schedule an appointment. All right. So what were you about to say? Did someone have a comment on the bird flu?
Oh, no.
Okay. All right. But yeah, so everyone be careful. Make sure you're keeping up with the CDC, with the news, and especially if you're in California. And if you eat chicken, if you eat beef, any of those things, make sure you're careful and look for symptoms. A lot of the symptoms are just very similar to the common flu. You can get high fever, chills, muscle aches, body aches. It can even cause respiratory illness. It can cause respiratory failure, and it can lead to you being unalive, the bird flu. So it's quite serious. We only have one person who has been serious enough to go to the hospital. But for those of you who've been living here with all the different shutdowns and lock-ins that we've had in the past, anything is possible. So just make sure you pay attention. All right. Shall we talk about the Kardashians, Shador? Let's just slip that one in real quick. Kim Kardashian broke her foot. Lord help me, she done broke her foot. But instead of wearing a nice little old plain, boring, ugly cast like everyone else with the little white tissue cast plaster material wrapped in an old brown ace bandage, and you just kind of hobble along, child, she has a high heel cast. So let's talk about that, and I'm going to get your opinion.
Kim Kardashian shows off her wild high-heeled cast, broken foot, but make it fashion. Kim Kardashian appears to have fashioned herself a high-heeled cast for her fractured foot. On Tuesday, the Kardashians' star, 44, posted a photo of her foot wrapped in an off-white, gauze-covered shoe on her Instagram story. The open-toe cast featured a thick platform mirroring a wedged booty. Fans praised Kardashian's unusual design and predicted it would become a new trend, with one person tweeting, "You already know somebody is about to copy this too. Broken foot, but make it fashion," another quipped. A third pleased person said, "I can't say anything less than I do," while another raved that the unique cast is
That's
innovative.
good. All right. Yeah, that's playing a little fast forward. But yeah, so Kim Kardashian, she broke her foot. And, say what you want about the Kardashians, keeping up with the Kardashians. Their mother, Kris Jenner, is a manager of a lifetime because she has taken a family with arguably minimal tangible talents. I think that's fair to say. And she's made billionaires out of them. Do they have a high work ethic? Does Kim Kardashian work hard? Does Kylie Jenner work hard on her brands? Yes, undoubtedly. However, I've just actually been reading or actually listening to a couple of novels about Kris Jenner, and she's a driving force where something as simple as the kind of cast you get can put you in the headlines. Okay, so Kim Kardashian, she has the cast. It's a high heel cast. And I know some people have been questioning, like, is that smart? Is that healthy? I'm going to go ahead and trust that whatever orthopedic surgeon put her in the high heel cast, and it is a platform, I'm going to trust that they have her foot at the proper angle, and then they were somehow able to make it where it looked more elegant into a cast. Is that a problem? No, not the orthopedic surgeon is sure that is, going to heal in a fashion that it's supposed to, and her foot is at the right angle. Do I think it's unnecessary? Do I think it's frivolous? Perhaps, but hey, that's her brand. She's the one with billions of dollars. So it's always up to her. Do I think that other people should run around and try to mimic it? Not necessarily. I'd be careful. You have to remember that for people like Kim Kardashian, they have the access to the money, right? They have the access to the best. They can fly in the top orthopedic surgeons from all around the world. If you go to, your orthopedic doc and that's not what they do, and they're trying to mimic Kim Kardashian to give you something fashionable and it's not done properly, you might be in a situation where you're trying to have a high heel cast and you impair the healing of your foot. So more power to Kim Kardashian, assuming that her top orthopedic surgeon, gave her the high heel cast in a way that won't be harmful. But I wouldn't necessarily go and try to mimic a billionaire's health intervention if you don't have a billionaire's budget. That's just my opinion. Okay. And if anyone else has any comments, then we might be able to touch on a couple of those. Okay. With that, I think we'll go ahead and get ready to wrap up. And so if any of my members, if you're here, if you have any questions or if we have any super chats, then we'll get to those questions. Other than that, I will go ahead. I'll let you know when we'll do our next members only live Q&A where we'll spend the whole time answering questions. But yes, do make sure. Oh yes, y'all know the holidays are here and Christmas is coming up. What better gift than the gift of health? Make sure you click the link in my description. Also, you can go to my website, dr.frita.com. That's DRFRIT, as in take care of yourself, a.com, and go to my favorite things. And that's where I list my juicer that I love to use, my Nama J2 juicer. That's an excellent gift. And I have a discount code for you that you'll see in my favorite things, Dr. Frita 10. Also, I have a blood pressure cuff, one of the Omron cuffs, which is really good. And you can even use it with your smartphone. There's some other Omron cuffs that are good as well. That's one of my favorites that I have on the My Favorite Things. So you can check that out if you want to give someone the gift of health. And another gift of health, my book, Under Pressure, A Guide to Controlling High Blood Pressure. Okay, I talk about, yes, holistic ways to lower blood pressure, lifestyle, exercise, deep breathing, foods, all of that. I also talk about medicines because, I have studied Western medicine at Meharry, Georgetown University, Emory, all the things. And so, yes, I do prescribe medicines when necessary. I also believe in an integrative approach to medicine. And make sure that while you're on this YouTube channel where we have over 815,000 subscribers, if you haven't done so already, please subscribe. Please join us. And I have a couple of new videos out. I have 9 winter comfort foods to help you lower your blood pressure and to promote heart health. And then hot off the press, I have a video where I took you grocery shopping with me. Y'all, I took y'all down to the grocery store. I took you grocery shopping with me and I show you the best daily foods to eat if you're trying to manage your type 2 diabetes. I also get into the difference between type 1 and type 2 diabetes. That's one of these nuances that's lost on a lot of people. So I talk about that in the video as well. So I definitely thank you all for watching. Let's see, do any of our members have questions or do we have any questions that we can get to really quickly?
Yes. So Kim, I remember Kim.
Hi, Kim.
Briefly, will her foot, so Kim Kardashian, will her foot heal properly with the type of cast?
So the way that it looks from the outside looking in, and that when we attend medical school, we do all the rotations, we do orthopedic. I've never seen a cast like that, but that doesn't mean that it won't. I'm going to go ahead and have faith in the orthopedic surgeon that they angled her foot in a way that even though it looks like she's on a high heel, I'm going to bet that her foot is probably at a proper angle to heal properly. I don't know that, but it would be malpractice if an orthopedic surgeon had her foot at an angle where it doesn't heal properly. So I'm going to go ahead and just assume that it will heal properly. But like I said, don't try this at home. Don't go to your orthopedic surgeon and try to get them to try something they haven't tried before. Yeah.
All right. Next question comes from Roxanne, her first time in the chat.
Hi, Roxanne.
She says, my daughter came home to Illinois from California sick as a dog. She went to prompt care here. They prescribed prednisone, but that cough won't go away. Any tips on taking away the cough?
Okay. So my number one tip would be for her to go back to the doctor because, what I give on here is information, but it does not replace the advice of a physician. And, it's impossible for me to know without actually seeing her, examining her, listening to her, the cause of the cough. So in them giving her the prednisone, that means that they felt that she had some inflammation in her lungs, right? Some inflammation in her bronchioles and her lung tubes, maybe even some type of a bronchitis. And they felt like the prednisone would take down some of the mucus, some of the inflammation. She still has the cough. So maybe it's just lingering. Maybe it will get better. Or it could be that she actually has an active infection, be it a virus, be it a bacteria, be it a bacterium. And if that's the case, then she needs to go back because she might actually need an antiviral medication. Okay. If it's the flu and if she's in that proper window, she might need Tamiflu. If they think it's something like a walking pneumonia, she might need something like an azithromycin. If they think it's something like a lobar pneumonia, then she might need another type of an antibiotic. You also want to make sure that they've examined the chest x-ray properly to make sure she doesn't have any fluid in her lungs. Okay. And so prednisone is a common treatment for getting inflammation down. So sometimes someone will have to take the prednisone by mouth. She might also be given an oral, an inhaled steroid, okay, to help, and even an albuterol. But yeah, if the cough is still there, I recommend going back to see your physician, and depending on the severity, she may need to see a lung doctor or a pulmonologist. Yeah, I wish her well.
All right, thank you, Dr. Frita. And then all the way from Dublin, Ireland, shout out to Thomas.
Yay! Thank you for coming from Dublin, Ireland.
He says, I love you, Dr. Frita. You're the best YouTuber I have ever seen.
Oh, I love you right back. Thank you so much for that. I appreciate you.
All right, Dr. Frita.
All right. Well, that's a wrap. I want all of y'all to have a Merry Christmas. Enjoy your holidays. Stay safe. If you partake in alcohol, please don't drive under the influence, and make sure you're making wise decisions. We'll be right back. Okay. We'll catch y'all before the new year. Same bat time, same bat place here on Medical Monday at noon Eastern Standard Time. I thank y'all for watching. I appreciate you. And hey, we'll see you next time. Thank you, Shador.
You're welcome. Merry Christmas.
Merry Christmas.